My research proposal for Counseling 503 is regarding whether or not military families have more incidents of domestic violence than civilian families. I became interested in this topic due to having several clients who were married to military officers report to me that they were subject to domestic violence at some point in their relationship. Therefore, I decided to look into research to form a hypothesis, which is, do military spouses engage more often in domestic violence than civilian spouses? The null hypothesis being that military spouses do not engage in increased domestic violence. The purpose of this study was to find out if there was an increased risk of military marriages being involved with domestic abuse. The research that was found went even further to discuss types of stressors that might influence domestic violence in military marriages, which we will discuss later. The relationship was also studied in order to find out if there was an increase in domestic violence in military families and what could be done to prevent this. For this study, a self-report questionnaire was used. The questionnaire was given to women seeking medical care in a family physician practice. This facility was within 15 miles of a military base. The self-report was given to them upon arrival with their other paperwork, with 2 items that were added to the questionnaire, which related to their relationships with the significant other and whether they've been in that relationship for 12 months or more, and whether the partner was in the military. The HIT self-disclosure screening tool was used. The HIT self-disclosure screening tool indicates the frequency with which the subject's partner acts in the depicted way. The questions are, number 1, physically hurt you, 2, insult or talk down to you, 3, threaten you with harm, 4, scream or curse at you, and each item is scored 1 to 5. The scores range from 4 to 20 on this inventory. A score of 10 or more is considered positive, and this would indicate domestic violence. The HIT self-report scale has a sound validity and reliability for being able to identify domestic abuse victims. It has a Cronbach's X of 0.80, showing that it is highly reliable for a measure of domestic abuse. Using a cutoff score of 10.5, Shurin, the developer of the HITs, accurately classified 91% of non-victims and 96% of victims in this study. Several studies suggest that relationship between domestic violence in a military household is higher than in a civilian household. In a study by Schmidt, he reported that known cases of spousal abuse in the military families rose from 12,000 in 1988 to 18.1 per thousand in 1993. He took the study even further and discussed several factors that could influence domestic violence in the home of the military personnel, such as dangerousness of the job, stress of deployment, separation from family and friends. Lutengoff in 2012 completed an observational study of patients presenting for prenatal care to a naval hospital between January 2007 and March 2008. An abuse assessment screen was provided. The data was summarized using medians, interquartile ranges, and frequency distributions. Of the 1,162 surveys given, 14.5% screened for positive domestic abuse, either current or past, and 1.5% of the respondents reported current pregnancy abuse. The conclusion of this study found that the prevalence of domestic violence in our pregnant military population was 14.5%, which is in the upper prevalence reported in the non-military. Therefore, based on this project and other research, it was determined that there is a significant increase in domestic violence in military homes. Further research is recommended due to the limitations of the tool that was used in this research. The tool was a self-report questionnaire which can be flawed by self-perception of the test taker or the need to respond in a socially acceptable manner, or also the need to hide the domestic abuse in the household and therefore not being truthful on the self-report questionnaire. It is recommended that this study be replicated and also another component be added which would address the stressors of the military family and what they are facing or were facing at the time of the domestic violence. This research is important for the counseling community in order to understand the military culture and the attempt to lessen the domestic violence in these homes by providing preventative services. Thank you.